Okay, hello. This is Jessica, the respiratory therapist, and I'm here to do another patient from the various scenarios. And we have patient number 4. She is 6-year-old Lila. She has cystic fibrosis. Her mom is here with her, and she takes albuterol by nebulizer and Pulmicort at home already. And the doctor wants her to take Pulmozyme, unidose Pulmozyme as well. So I'm going to explain to Lila and her mom why we're doing the Pulmozyme now. So the main issue with the cystic fibrosis is the mucus production, especially in the lungs. So the mucus in cystic fibrosis I can't say that word, cystic fibrosis in the lung is very thick and viscous, and it clogs up, it's difficult to get out. So the albuterol, as a bronchodilator, keeps the airways open. When you have large amounts of mucus, you want to expectorate. You don't want to have little tiny airways to move the mucus through, because you won't. So you have the albuterol to open that up and help move the mucus to expectorate it. Also, the Symbicort, the steroid, keeps inflammation down, because inflammation, once again, causes the bronchoconstriction, which tightens up the airways and makes it hard for Lila to get the mucus moving out of her lungs so she can breathe. So we have those 2 medications already. And now Pulmozyme is mucolytic. Cystic fibrosis, the bulk of it, what makes it so thick is actually it's DNA, dead DNA. DNA from dead neutrophils, white blood cells, eosinophils. It's dead waste from infections in cystic fibrosis lungs. So it makes up the bulk of the thick mucus that can't move. What Pulmozyme does is it actually destroys the DNA protein-based thick part of the mucus. It eats the DNA up. So it takes that big, thick bulk part and destroys it and makes the mucus thinner and easier for Lila to expectorate. So with the Pulmozyme on top of the steroids and the albuterol opening up the airways should make it a lot easier for her to get the the mucus out. The Pulmozyme is a pretty benign medicine per se. Some of the side effects that do happen are voice alteration due to change in the glottis. Pharynx or laryngitis can happen. Sometimes with Pulmozyme application, you'll get dyspnea, which is a fun way of saying breathing irregularly, so maybe just irregular breathing. She can have a cough increase, once again, just because of meditation irritating her, that kind of thing. Yeah, I just realized that I have no idea how exactly you take Pulmozyme. Does it come in a nebulizer? I would assume so. Yep, there it is. Sorry, brain problem. It's once a day. It's right there in front of me. It's once a day. It's 2.5 milligrams and 2.5 milliliters, which you just put in your nebulizer. You put the nebulizer, you can add it in with the albuterol if you'd like, just to make it easier. 1 application, 1 dose. I'm sorry, I apologize. I just brain fart. So they do want you to use certain nebulizers, though. There's certain ones I think you can use them in other ones, but they have to be approved. There's a list of nebulizers that are approved for Pulmozyme, so I'm going to take that back. Don't put it in with your albuterol unless you have these certain nebulizers. Once again, I apologize. I have it written on a different page, and I didn't study it because I forgot that was part of my Pulmozyme. I'm so sorry. Hudson, Updraft, Acorn 2, or the Perry LC+. A lot of people have Perry's. I'm going to double check that. So if not, we can hook you up with a nebulizer for her to use. So once again, the Pulmozyme just is going to reduce the thickness of the infection, or of the mucus, make it easier for Lila to move, and therefore that action alone will reduce the infections. It reduces the infection because there's less mucus to draw infection in. It's the big part of what causes the infections is the wet mucus stuck in the lungs. So move that out, less infections. Okay, so that would be my little education on Pulmozyme. Yeah, okay. Bye.